Hi, I'm Dr. Phillip Chang. I am the owner of Aesthetica Cosmetic Surgery and Laser Center. And today I want to show off some of our new technology. In previous video I showed off what we did with breast augmentation using a VECTRA camera system. What this system does is it's able to take my patient pictures in 3 dimensions, and we can manipulate those pictures on a computer screen and show you what you might look like before and after surgery. So this here is a patient picture that we've taken previously, and in this picture you can see that you can see what she looks like, and you can see that the camera has actually taken her in also 3 dimensions. And so in this module what we're going to do is show off how this can change, or you can see the patient's picture before and after a rhinoplasty or nose surgery, also I'll call the nose job. So we're going to turn on the rhinoplasty module, and on this rhinoplasty module, the first thing that it's going to do is it's going to show off the patient's landmarks. So it's going to show off, you know, what the width of the nasal base. It's going to show where the tip point is, where the upper lip landmarks are. So it shows the different points that are important for us as plastic surgeons to define what we're going to do. So again, we're going to go to the rhinoplasty module, and this is the same patient from the side view. And so, you know, obviously with this patient, you know, this patient came in mainly because they were unhappy with this, what we call the dorsal hump. But also, if you look at the patient from the front view, this actually doesn't look so bad, but for the purpose of this video, we can change various different things. So we can change the base width of the nasal nostrils. We can change the width of the nasal tip. We can even change the width of the nasal bones. And so from the side view, that's where we're going to start. You can see that, again, the patient is most unhappy with the dorsum of her nose. And so with this module we can use these different tools to lower the hump, and so we're going to do that, and you can see it change right in front of you. And so that's lowering the hump. It doesn't do a perfect job, but we also have other tools that we can improve on that a little bit, and so it still has a hump over here, and I can push that in a little bit more. Okay, so this gives a first clue of what we might be able to do with this patient's nasal tip. Do that a little bit better, I think. So bring this in just a little bit more. Okay. So remember, this is just a computer simulation, and you know the results are not exactly the same, but it gives you a first clue of what you should be able to do potentially with the surgery. So now I want to see the tip, the patient in the front view, and I'm going to reduce the width of the nostrils here, and that would be here, and so just a little bit of a narrowing, even though again this patient probably doesn't need it, but I'm going to narrow it a little bit right there. I'm going to narrow the nasal tip right here, and you can see it change right there. I'm going to narrow what we call the upper lateral cartilage, which is this middle nasal area, and so we're going to do that and narrow that down. Let's narrow it down a lot, just for fun. And then we're going to narrow down the nasal bones up here, and that narrows it down over there. So you can see that this tool gives you an idea of what you might be able to look like before and after surgery, and we're going to see a comparison between what this patient looks like before the manipulation and then after the manipulation, and that's, you know, again, it gives you a very good first clue of what we have the potential of doing. And so if you turn the patient to the side, that looks pretty good. Turn the patient to the front, you know, we've narrowed down the nose just slightly to kind of match the relatively narrow face that this patient has. Lastly, if you change this patient to the side, you can see that the patient also has a very, you know, weak or retruded chin, and so we can do a chin augmentation also. And so with this, we can just bring that chin out a little bit, and not much at all. And again, you can see the before and after with the chin augmentation, and that's kind of pretty neat. So my patients, you know, when they come to my office, they have the opportunity to use some of the technology that we have. We are the only office with the VECTRA in Loudoun County, and so I think that looks pretty good. Thank you.